Good morning, everyone. My name is Dr. Crisanto, and I've been practicing internal medicine for the past 23 years. In that time, I've treated thousands of patients, worked in hospitals, and run a private practice where I see patients ranging from their 20s all the way to their 90s. And I want to tell you something that has been troubling me for quite some time now. Something that I think deserves your immediate attention, especially if you or someone you love is over the age of 65 and taking medication for high blood pressure. We live in a world where we're constantly told to blame aging for everything. Our parents fall down and we say, well, that's just aging. Our grandparents become forgetful and we think, of course they're getting old. They lose their balance and we assume it's just part of the natural process. But here's the problem with this thinking, and this is what I want to challenge you on today. Sometimes we're not dealing with aging at all. Sometimes we're dealing with something far more preventable and far more treatable. Sometimes we're dealing with medications that were prescribed with the best of intentions but are causing serious, measurable harm to our seniors. I stand before you today because I've seen too many patients, too many good people, suffer consequences that could have been avoided. I've watched families struggle with changes in their loved ones that nobody quite understood. And I've learned that in many cases, the culprit wasn't aging. It was the very medications meant to protect them. Today, I want to talk to you about 3 of the most commonly prescribed blood pressure medications in seniors, and I want to explain why, for many older patients, these medications might be doing more harm than good. This is not anti-medication talk. This is not me telling you to stop taking your prescriptions. This is me asking you to think critically, to question, and to work with your doctor to find solutions that truly serve your health and your quality of life. Let me start by giving you some context. High blood pressure affects approximately 1 in 3 American adults. In people over 65, that number climbs significantly. We treat it aggressively because high blood pressure is indeed a risk factor for stroke, heart attack, and kidney disease. But here's what we don't always talk about. The treatment itself can sometimes create new problems while solving the original one. And for seniors whose bodies have changed over decades, whose organs work differently, whose medications interact in complex ways, this becomes an even more critical issue. The first medication I want to discuss is a class of drugs called ACE inhibitors. Now, ACE inhibitors are among the most frequently prescribed blood pressure medications in the world. They work by relaxing blood vessels and reducing the workload on the heart. They've been studied extensively, they're generally considered safe, and they have benefits beyond blood pressure reduction. And this is a significant but, they come with side effects that are particularly problematic for seniors. One of the most common issues I see is a persistent dry cough. Now you might think, what's the big deal about a cough? But imagine having a cough that lasts for weeks, months, or even years. Imagine not being able to sit through dinner without coughing. Imagine disrupting your sleep night after night. I've had patients who developed such severe coughs that they actually fractured ribs from the constant coughing. One of my patients, a 72-year-old woman named Margaret, came to me after taking an ACE inhibitor for 18 months. She had developed such a severe cough that she was terrified she had lung cancer. She underwent multiple tests, CT scans, chest x-rays, all negative. But the cough persisted, and it was destroying her quality of life. But the cough is just one piece of the puzzle. ACE inhibitors also cause hyperkalemia, which means elevated potassium levels in the blood. Your potassium levels are critical because potassium helps regulate your heart rhythm. Too much potassium, and you're looking at irregular heartbeats, weakness, and in severe cases, cardiac arrest. Seniors are particularly vulnerable to this because as we age, our kidneys don't filter potassium as efficiently. If a senior is also taking other medications or supplements that increase potassium, or if they have kidney disease, the risk escalates dramatically. I've had to hospitalize patients for hyperkalemia caused by ACE inhibitors, even in patients who were taking the medication exactly as prescribed. There's another side effect that doesn't get talked about enough, and that's angioedema. This is swelling that occurs usually in the face, lips, tongue, or throat. It can happen suddenly, and it can be terrifying. I had a patient, Robert, who took an ACE inhibitor for 3 years without any problems. Then one morning, he woke up, and his lips and face were severely swollen. He rushed to the emergency room. We treated it, and thank goodness it resolved. But angioedema can be life-threatening if it affects the throat and makes breathing difficult. The incidence is about 1 in 1,000, but when you multiply that across millions of seniors taking these drugs, we're talking about hundreds of thousands of people experiencing this. Now, let me move to the second medication class I want to discuss, diuretics, also called water pills. These are among the oldest blood pressure medications we have. They work by causing your kidneys to eliminate sodium and water, which reduces blood volume and therefore blood pressure. Doctors love prescribing them because they work, they're inexpensive, and they're easy to understand, but for seniors, they can be absolutely devastating. The primary issue with diuretics in older patients is dehydration and electrolyte imbalances. Our seniors don't have the same thirst mechanism that younger people do. As we age, our sense of thirst diminishes. This is a well-documented physiological change. So, a 75-year-old taking a diuretic might not feel as thirsty as they should, and they might not drink enough water. This can lead to dehydration, which in seniors manifests in ways that are often attributed to aging, confusion, dizziness, weakness, and falls. Falls, this is critical. Do you know that falls are the leading cause of injury death in older adults? 1 in 4 seniors falls each year. 1 in 4. And dehydration from diuretics contributes significantly to this problem. I had a patient, Dorothy, who was 81 years old. She'd been on a diuretic for years. She started having dizzy spells and falling. Her daughter thought it was just aging. But when we reduced her diuretic dose and made sure she was staying hydrated, the falls stopped. Stopped completely. She's now more independent and more confident in her daily life. But there's more. Diuretics deplete not just water, but critical minerals like potassium, sodium, and magnesium. Low potassium can cause muscle weakness and dangerous heart arrhythmias. Low sodium can cause confusion, headaches, and seizures. Low magnesium can cause muscle cramps, fatigue, and weakness. And here's the thing. These side effects are insidious. They develop gradually. A family member might notice their loved one becoming more confused, more weak, more tired, and they chalk it up to aging or even depression or early dementia. I've had families who thought they were losing their parent to cognitive decline when the real issue was simply electrolyte imbalances from a diuretic. Additionally, diuretics can cause hyperglycemia, which means elevated blood sugar. For seniors who are pre-diabetic or managing diabetes, this can push them over the edge into needing additional medications. It creates a cascade effect where one medication creates a problem that requires another medication, which creates another problem, and so on. Now, the third medication class I want to discuss is one that's become increasingly popular in recent years: calcium channel blockers, specifically non-dihydropyridine calcium channel blockers like diltiazem and verapamil. These medications work by blocking calcium channels in heart and blood vessel cells, which causes relaxation of the vessels and reduces heart rate. The major problem I see with these medications in seniors is severe bradycardia, which means an abnormally slow heart rate. A normal resting heart rate is somewhere between 60 and 100 beats per minute. But I've seen seniors on calcium channel blockers develop heart rates in the 40s or even the 30s. You might think, lower heart rate sounds good, but that's not how it works. If your heart is beating too slowly, your brain isn't getting enough oxygen, your muscles aren't getting enough oxygen, your organs aren't functioning optimally. I had a patient, James, who was 78 years old. He was on a calcium channel blocker for blood pressure. He came in complaining of constant fatigue, shortness of breath, and what he described as brain fog. He'd retired 5 years earlier and had planned to travel with his wife, but he couldn't manage more than a short walk. His daughter had noticed he'd become withdrawn and depressed. When we checked his heart rate, it was 42 beats per minute. We adjusted his medication, and within weeks, he had his energy back. He and his wife took that trip to Europe they'd been planning. Another significant issue with calcium channel blockers in seniors is severe constipation. This might sound minor, but I assure you it's not. Chronic constipation in elderly patients can lead to fecal impaction, which is a serious medical condition. It can cause bowel obstruction and, in severe cases, perforation of the bowel. I've had patients who required hospitalization and even surgical intervention because of severe constipation related to calcium channel blockers. There's also a phenomenon called peripheral edema, which is swelling in the legs and feet. This occurs in a significant percentage of patients taking these medications. For seniors, this can be particularly problematic because the swelling can impair mobility and increase fall risk. Imagine your legs and feet are swollen and uncomfortable. How much are you going to want to move around? How much are you going to exercise? This sedentary lifestyle then contributes to muscle weakness, deconditioning, and increased frailty. Now, I need to emphasize something here, and I want you to really hear me on this. I am not saying these medications are bad. I'm not saying they don't have their place. What I'm saying is that they are often prescribed without adequate consideration for how differently seniors metabolize drugs, how much smaller the therapeutic window is, and how easily side effects can be misattributed to aging. The real tragedy is that when side effects occur, they're often blamed on getting older. A senior becomes confused, and the family says, "Well, Grandpa's memory has been slipping anyway." A senior becomes weak, and we assume they're just deconditioning. A senior falls, and we buy them a walker and install grab bars, when the real solution might be adjusting their medication. We've created a culture where we expect decline in our elderly, and we accept it as inevitable, when so much of it is actually iatrogenic, caused by medical treatment. Let me give you some data points that I think are important. Studies have shown that seniors prescribed multiple blood pressure medications often don't actually need them all. One landmark study called the Accord study looked at intensive blood pressure control in seniors with diabetes. The result? Aggressive blood pressure lowering didn't reduce cardiovascular events in seniors over 75. In fact, some patients actually had worse outcomes. Yet we continue to prescribe multiple blood pressure medications to seniors, stacking them on top of each other, each one adding its own side effects. Another study looked at medication errors and adverse events in seniors. Seniors comprise about 13% of the population, but account for about 1/3 of all prescriptions and about half of all adverse medication events. We're talking about harm, real, measurable harm, caused by medications. The question you should be asking is, why does this happen? Why are we prescribing medications to seniors that have such significant side effects? Part of the answer is that most clinical trials that test medications are not done in elderly populations. The average participant in drug trials is in their 50s. But seniors are often quite different physiologically. Their kidneys work differently. Their livers process drugs differently. Their body composition is different. What works in a 50-year-old might be too much for an 80-year-old. Another part of the answer is that we in the medical field have been taught to be aggressive with blood pressure management. We've been told that lower is better, that we should aim for aggressive targets. But the evidence increasingly shows this isn't true for all populations, particularly for elderly populations. An older person with blood pressure of 140/90 might actually be fine. That blood pressure might be appropriate for them. Bringing it down aggressively with 3 or 4 different medications might do more harm than good. I also think there's a problem with how we educate patients. We don't spend enough time explaining to seniors and their families what these medications actually do, what the side effects are, and what the alternatives might be. We write prescriptions, and patients take them because they trust their doctor, and they assume that whatever side effects they experience are just part of getting older. So what should you do if you or a loved one is taking one of these medications? First, don't panic. These medications, used appropriately, can be life-saving. The goal is not to stop taking them necessarily, but to take the right amount, the right medication, for the right patient, at the right time. Start with a conversation with your doctor. Ask specific questions. Ask why you're on this particular medication. Ask what the target blood pressure is and why that target was chosen. Ask about side effects. Tell your doctor about every symptom you're experiencing. Don't assume anything is just aging. That fatigue, that confusion, that weakness, that constipation, that dizziness, these could be medication side effects, and your doctor needs to know. request a medication review. This is something I do regularly in my practice. We sit down, we look at every medication the patient is taking, we look at the indication for each one, we look at whether it's still needed, and we look at whether the dose is still appropriate. In many cases, we find we can reduce medications or eliminate them entirely. Consider getting a second opinion, particularly if you're taking multiple blood pressure medications or if you're experiencing significant side effects. Different doctors have different approaches. Some are more conservative with blood pressure targets in seniors, and there's evidence to support that approach. Monitor your blood pressure at home if you can. Home blood pressure monitoring is more accurate than office readings anyway. Many seniors on these medications don't actually need to be on them if you look at their actual home pressures. Stay hydrated, particularly if you're on a diuretic. Drink water consistently throughout the day. Don't wait until you're thirsty. Get your electrolytes checked regularly if you're on a diuretic or an ACE inhibitor. Simple blood tests can detect problems early. Stay active. Exercise is one of the best blood pressure medications we have. A senior who walks 30 minutes a day, 5 days a week, might be able to reduce or eliminate blood pressure medications entirely. And finally, remember that you are the expert on your own body. If something doesn't feel right, speak up. Push back if necessary. Your doctor works for you, and you have the right to ask questions and seek other opinions. I want to tell you about one more patient because I think her story really illustrates what I've been talking about. Her name is Ruth. She's 83 years old. She came to me 3 years ago on 4 different blood pressure medications. She was experiencing confusion, fatigue, falls, and constipation. Her family was considering a memory care facility because they thought she had cognitive decline. When I reviewed her medications, I found that her blood pressure was actually quite good, 132/82. She didn't need 4 medications. We slowly reduced her medications to just 1, a very low dose of a beta blocker, which her heart actually needed for a different reason. Within 4 weeks, her confusion cleared completely. Within 2 months, her energy returned and her falls stopped. She hasn't fallen in 3 years. Last month, she called me to tell me she'd gone on a trip to visit her grandchildren. She was functioning, engaged, active, and happy. That's the power of careful medication management in seniors. This is what I want for all of our seniors. I want them to live well, not just long. I want them to be active, engaged, and independent for as long as possible. I want them to travel, to spend time with family, to pursue hobbies and interests. And I believe that thoughtful, individualized medication management is a key part of making that happen. The next time you're caring for an older person, or the next time you're taking medications yourself, I want you to remember that aging doesn't have to mean decline. We've been programmed to think that decline is inevitable, that loss of function is just part of the process, but so much of what we see isn't aging at all. It's medication side effects, it's drug-drug interactions, it's dosing that was appropriate at one point but is no longer appropriate. It's medications that were started for good reasons but are no longer needed. Your body, your mind, your independence, these are precious. They're worth advocating for. They're worth asking questions about. They're worth getting a second opinion about. Please, talk to your doctor. Ask about your blood pressure medications specifically. Ask if your doses and your drug regimen is still optimal for you. Ask about alternatives. Ask about lifestyle interventions. Ask about monitoring. These conversations might be the most important ones you have. I've spent more than 2 decades watching people suffer unnecessarily because we attributed problems to aging when we could have solved them with thoughtful medication management. I don't want that to happen to you or to the people you love. I want you to be empowered, informed, and actively involved in your healthcare decisions. As you leave here today, I want to ask you to do a couple of things. If this information has been helpful, if you found value in what we discussed, please subscribe to our channel. We cover health topics like this regularly, and I want to make sure you don't miss future content that could impact you and your family, and please leave a comment. Tell me what resonated with you. Tell me about your experiences with blood pressure medications. Are you seeing these side effects in yourselves or your loved ones? Your comments help me understand what's important to you, and they help other viewers find this content and benefit from it as well. Let's create a community where we're having honest conversations about medication, about aging, about quality of life. Subscribe, leave a comment, and thank you for listening. Take care of yourselves.